Hi, Dr. YASS here. I have a question that I really would like you to ponder regarding the medical system treating you for your pain and other symptoms. The question is, why would a person consider getting a second back fusion after the first fusion did not resolve the pain and in fact may have increased the level of pain? Why would a person get a revision or second revision or third revision to a hip or knee replacement when the first attempt failed to resolve the pain and again may have increased the person's symptoms? Why would a person consider getting radiofrequency ablation to address their pain, which basically is an attempt to cauterize your nerve, or in fact burn your nerve, and think that that is a rational decision? Why does someone get an epidural nerve block, which could never actually address the tissue in distress eliciting your symptoms? Why would someone be willing to go on an opioid, which is synthetic heroin, with the understanding that there is a high propensity towards addiction? When you listen to these questions, you certainly would think to yourself, well, a rational person would never consider this. The answer is that the problem for most people is that they perceive that the medical establishment is a monopoly, that in fact there is no alternative to treatment outside the medical system. So the typical person says to themselves, well, I have these symptoms and this dysfunction. I know I have to do something. Nothing isn't the solution because it's not going to do anything to resolve my symptoms of dysfunction. So I know I have to do something. And since this is the only alternative, even though it seems irrational, well, it's the only alternative. And therefore, I assume that's my only choice. And that's why that manipulation of surgery as a last resort is such an effective mind screwing. The reason is because if you think there's no alternative and they've got you to accept the idea that surgery is your last resort, well, then you're acceptive of getting a surgery which was never rationally proved to be valid. Let's understand there is an alternative to the monopoly of the medical system. The medical system primarily establishes cause by the use of diagnostic tests like MRIs and X-rays. These are baseless tests. They utilize the idea of correlative theory, which is to simply say that for the first time the structural variation is identified at the time of your symptom, therefore it is asserted to be the cause of your symptom. This is baseless in multiple numbers of ways. The structural variations identified were found in as many people with no pain as those with pain. The location of the symptom could never be created by that structural variation, if in fact that structural variation did create the symptom. Muscular causes can never be found on diagnostic tests. Results are disgraceful in terms of surgical attempts to correct these structural variations to resolve symptoms that have been created. Everything says that the system is baseless, and yet if you perceive it as a monopoly, you will be doing something that rationally, if given an alternative, you would say makes no sense, and therefore I would never do that. And yet that's what people do. Let's be very clear. The YASS method is an alternative. Without any question, it sits outside the medical system. The YASS method utilizes an attempt to interpret the body's presentation of symptoms to identify the tissue in distress that is in fact eliciting those symptoms. Let's make sure we understand this. The symptoms you're experiencing are being elicited by the tissue in distress as a way of creating conscious awareness of that distress so that you can get an intervention to resolve the distress of the tissue. Once the distress is resolved, that tissue no longer has to elicit its emergency signals of symptoms, and it stops. It ceases. You don't treat symptoms, you treat tissues. Okay? So, there is a direct relationship. If I want to identify the tissue in distress, I could interpret the symptoms, right? If I want to understand what symptoms may be created, I can understand that through understanding what tissue may create it. It goes both ways. That's the magic of how you know the YASS method is 100% irrefutably accurate in its theoretical presentation. Causes create symptoms. Symptoms are created by causes. You could go both ways. That's the magic of it. You cannot say the same thing for diagnostic tests. Herniated discs create pain when pain is identified. Really? Okay. So then when pain is identified, can you tell me which disc is creating it, that a disc is creating it? Absolutely not. And the way you know that is you could go to your orthopedist right now today and ask them, if I showed you 10 MRIs showing herniated discs or arthritis or meniscal tears, can you tell me who's in pain? And the answer would be irrefutably no. No. Because it's well understood that the majority of people not in pain have the same structural variations. Therefore, there is no connection between structural variations or abnormalities and pain, period. So this idea of identifying it at the time you're having pain and say, oh, since I found it at the time you're having pain, that's the cause, it's psychotic. Baseless. Baseless. You understand baseless? Not some sense of validity. No validity. Zero. Zero. That's why it fails. Understand there is an alternative. The YASS method. This is not a treatment model. This is a diagnostic model, which helps to identify the tissue in distress, eliciting your symptoms by interpreting the body's presentation of symptoms, which those symptoms are in fact being elicited by that tissue. Once you get the right diagnosis, then you can get the right treatment. In 98% of cases, the cause of pain is muscular. It's great. Fantastic. Now the treatment can be targeted progressive resistance exercise, which is at the core of the treatment model of the YASS method. You will have your symptoms resolved. The point of the video is clear. You do not have to be a prisoner of the medical system. It is not a monopoly. Do not think that for a second. If you hear about the YASS method, look into it. You want to contact me to get further questions answered? No problem. You can contact me at Dr. Mitch at mitchellyass.com. My email address, drmitch@mitchellyass.com. Dr. Mitch at mitchellyass.com. You want to set up a Skype or Zoom session for me to help evaluate you, establish what tissue's in distress. If it's muscle, we're going to provide you and have you perform under supervision the correct exercises. The sessions are videotaped, so you have reference after the fact. That's the way you get your symptoms resolved. If you want a Zoom session or a Skype session, you can contact me also through my email, drmitch at mitchellyass.com. If you like this video, and God, I hope people are seeing this and it's making sense. I've gotten such incredible responses recently. People are waking up. I know it. I can see it. The more I put out, the more people are finding it. It's coming up higher and higher in Google searches and YouTube searches, and people are responding, which is everything I've hoped for. The goal of this concept is to get people out of pain by a proper logical mechanism. So if you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe. Press the subscribe button so you can continue to get notifications when new videos are being provided or when I am live on YouTube. All right. The medical system's not a monopoly. You have an alternative, the YASS method. Let's use it. Let's lose the pain. Let's lose the symptoms. Let's get our function back. Let's have the quality of life we so justly deserve. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.